So I found iSmile through my sister. She actually had been here for several years, and I ended up working closer to their office and needed to switch up my dentist. And so she was like, come see Dr. Alpert. She's amazing. So now basically our whole family goes here now. When I first came, I was basically coming just for regular cleaning, and then we got into addressing more of my concerns that I had about teeth grinding, which opened up a door to all sorts of other things, of figuring out kind of non-traditional dentist issues that to solve some of my other things that you don't think about that relate to your mouth and dental needs. After probably a year or so of coming just for my regular checkups, we got talking about any specific concerns that I had about my teeth, and I mentioned being concerned about teeth grinding and kind of my back teeth getting kind of small, if you will. So Dr. Alpert did kind of a more intensive evaluation of my head and neck and mouth measurements. And that's kind of when we discovered that I have basically the size of like a child's mouth. And we did a head and neck CT to check my airway. And I didn't know that a lot of your teeth issues can be a result of airway issues. And I had chronic sleep issues and chronic strep as a child, and all those pieces kind of added up to the airway problem, and figuring out how this VIVOS appliance that I got through Dr. Alpert could impact my overall quality of life. So when we got into discussing the VIVOS appliance and how it could kind of benefit me, and putting the pieces together of some of my chronic issues from childhood and adolescence and even adulthood, of putting those pieces together from the research that Dr. Alpert had done about these type of issues. And, I had chronic strep as a child. I never slept super well. I had anxiety and depression. And as an adult, I had PCOS issues, polycystic ovarian syndrome issues, where, my brain, when I was sleeping, because it wasn't quality sleep, was firing cortisol all night, and that affecting my metabolism and all these kind of pieces that you wouldn't think about being related to your airway or your teeth in your mouth. And, I'd had like a 20-year battle of trying to find doctors that were, more Western aligned, if you will, of traditional issues, and them just wanting to treat the symptoms as opposed to figuring out the root cause of them. And Dr. Alpert helped me kind of figure out solving the mystery of where I needed to have a somewhat different path of how to treat things, and figuring out this VIVOS appliance for me, and how that completely changed my sleep and my airway and so many other things. Dr. Alpert first introduced the VIVOS appliance to me. She has an informational video that she gave me that was a comprehensive kind of review of her research and how the VIVOS appliance came to be, but the research behind it in terms of how over time, our jaw development has changed and has become weaker with a soft food diet. And everything kind of came together in terms of how I've had all these sleep issues, and kind of the first signs of having a small airway is having crooked teeth and having, a smaller mouth structure, and how it can impact, when you're sleeping with your mouth open because your airway isn't working very well. You have that cold air coming into your throat, which inflames your throat, and kind of some of the strep issues that come from that, and just so many things that made sense for my whole childhood through adulthood. So I think the video really made me feel seen, that I wasn't crazy, that all these things added up and continued to get worse as I got older, and how it all came together of solving so many of my chronic issues. So when I first started VIVOS, I started in February of 2023. And then I went pretty much until almost basically a solid 2 years of being in the device, and then coming in for different things to be, as my palate was dropping, we had to shave off some of the parts of the device as things were progressing. And I think I expected it to take a lot longer. And I feel like I made pretty good progress through that 2 years. And even, my sister and I have always looked a lot alike, but we had very different teeth, where my teeth were straight on, which I learned through Dr. Alpert is not natural. And my sisters were always a little more curved, which again, I learned through Dr. Alpert is more for her having proper tongue placement. And so as I worked through the VIVOS device, my whole family was amazed at how much more my teeth started to look more like my sister's. And it was crazy. And the biggest difference, I think, for me was on the sleep aspect, because I had a sleep apnea diagnosis, but it wasn't that, but it was really rooted in the fact that I had a small airway. And I remember my first appointment, my first within the first month of wearing the device, I came in and Dr. Alpert asked me if I had any dreams. And I thought that was such a strange question for a dentist to ask me. But I said, no, I felt like I was sleeping better, but I didn't have anything. But then my appointment the next month, I knew I was getting really quality sleep because I had so many vivid dreams that I could wake up and remember. And so the next time I came in for the appointment, the first thing I said, I was so many dreams. And we just laughed about it. But it's that was more indicative of having good quality REM sleep. So over the 2 years of treatment, in terms of just physical appearance, as part of the process, I had myofunctional therapy of tongue placement and tongue exercises to strengthen my jaw, and support the process of VIVOS. And I ended up needing a lip tie release and a tongue tie release, which I was probably the oldest patient to have those, because normally it's something that babies have, but it changed how my lips look. And as I was doing the exercises and as VIVOS was lowering my palate, just my jaw structure was changing, and then it supported a lot of some weight loss as well, because I was sleeping better and not shooting that stress hormone all the time. And I think the major difference that I noticed was not only the jaw structure, but just the reduction of so much kind of chronic inflammation everywhere, but especially in my face. And I can breathe so much better. As my palate was changing, I always had chronic sinus issues, and being able to breathe so much better, even exercising, getting so winded really easily because my airway was so small, and me thinking it was because I was out of shape, but it was really more my airway, and just so many things that add up and change so many things. But I think the sleep was definitely my most chronic issue my whole life. And I think even besides the physical changes, that has been the biggest game changer in my quality of life. iSmile, I love it.